The next question, the member for Oshawa.
Thank you, Speaker. And my question is to the Minister of Health. Critically sick patients had to be transferred out of Bowmanville Hospital when Lakeridge Health had to make the unimaginable decision to close the intensive care unit there because of a staffing shortage. Shelley, an ICU nurse who worked in Bowmanville, stood on the lawn of Queen's Park and bravely told us what it was like to watch fellow co-workers make the difficult decision to leave the bedside in a healthcare system where nurses cannot take it any longer. Bill 124 has unfairly suppressed wages, and exhausted nurses feel devalued, underappreciated and disrespected, and this after 2 years of COVID. We need the Bowmanville ICU to reopen. How will this Premier ensure nurses can stay and ICUs can stay open?
And to reply, the President of the Treasury Board.
Thank you very much, Mr. Speaker. Our government has a proud record of investments into healthcare, especially supporting our frontline healthcare heroes. Since March of 2020, we have added over 10,500 healthcare workers into the system. Mr. Speaker, this also includes investing in the first new medical school in over 100 years in the GTA to ensure that we have in Brampton, in the Durham region, in Scarborough, to ensure that we have doctors and healthcare professionals into the future. And, Mr. Speaker, the members opposite have voted against each and every single one of those measures to support healthcare workers and increasing the human resources in this province. We will continue to do what we can and ensure that we support our healthcare heroes across this province.
The supplementary question, the member for Nickel Belt.
Thank you, Speaker. Back to the Minister of Health. Speaker, people admitted to an ICU are really sick. Many have a 5 to 10% chance of survival. Bowmanville had to close their intensive care unit. They had to transport people sick enough to be in an ICU because they did not have enough nurses. It came with great risks. There is an easy solution that will keep hundreds of nurses on the job. Speaker, how much risk is the Minister of Health willing to take before she withdraw Bill 124?
Minister.
I've said many times it is concerning, deeply disturbing when an emergency room department or another department in a hospital must transfer patients. The Bowmanville 4-bed ICU unit was, of course, one such example. We don't want that to happen, which is why we have been investing in the province of Ontario, in our healthcare system, including $3.3 billion, bringing the total annual investment in hospitals to over $8.8 billion in the province of Ontario. Specifically related to acute and post-acute, we've made a historic investment of $1.5 billion to support the continuation of 3,500 acute and post-acute beds opening during the pandemic. Those beds will continue because we understand our population is growing. That's why we are making these investments in new hospitals in Ottawa, in Brampton, in Niagara. We're doing these investments because we understand the people of Ontario deserve no less. Speaker.
Thank you. Next, the member for Scarborough's Rouge Park.